So the executive order on pharmaceuticals just dropped by President Trump. How will it affect plastic surgery? So as you probably know, the executive order, which really shakes up the pharmaceutical industry, came this morning. In terms of how it affects plastic surgery, I do think it'll have a direct effect on neuromodulators and a lesser effect on dermal fillers and breast implants. So in a nutshell, the executive order basically says that the US has MFN. No, not what you think, most favored nation status. Generically, what that means is that the US should get the best pricing worldwide for pharmaceuticals. Now, the order is clear in that it refers to pharmaceuticals. It's actually a little less clear as to how it's going to be implemented. That's really up to Robert Kennedy, who's head of the HHS. So after 30 days, there's going to be some type of regulatory framework as to how this is going to be done and enforced. What's interesting is that, yes, it's for pharmaceuticals, but HHS, as you know, has a huge budget in terms of Medicare. Now, bear with me. I'll make this explanation as short as possible, but Medicare pays for a lot of things through health insurance. And botulinum toxin, Botox made by Allergan, is one of those things. You may not realize it, but there are muscle spasms, cervical dystonia, excessive sweating or hyperhidrosis, and other things which are actually covered under health insurance. And the treatment is Botox by Allergan. That means that yes, if you have the correct diagnosis and you have Medicare, Medicare will cover your Botox injection for very specific functional health insurance related issues. Why do you care? The reason why is that Botox has a dual use. It has a reconstructive health insurance Medicare use, and it has a cosmetic use, the one we love, which helps reduce wrinkles. So first off, in terms of pricing, under therapeutic use, Allergan will probably have to reduce the pricing of Botox in the US market. I'm talking about muscle spasm, things like that, and possibly raise it in other countries outside the US. Now, do your own research, but I already know this and you can confirm it. The price of Botox overseas is less than in the US, even for therapeutic use. This is where it gets interesting. If they are forced to reduce the price of Botox for therapeutic use, they will probably resist, but they may have to, based on PR, or based simply on the fact that it's still a pharmaceutical, have to reduce the price for cosmetic or aesthetic use. Now, we shall see. There are some market pressures involved. Some of it's not known because it's related to regulatory framework or decisions that HHS hasn't made yet, but we'll find out over the next month or so. To my knowledge, other neuromodulators or neurotoxins really aren't covered under health insurance for the most part. So I don't know if their cosmetic pricing will actually go down or not. Next up are dermal fillers. So what's interesting is that dermal fillers are considered a class 3 agent. They are not a pharmaceutical. So it's not under this executive order. What's interesting though is that Sculptra, which is a type of dermal filler, has a therapeutic use. It was originally indicated for lipodystrophy. Now Medicare and other health insurance companies do pay for lipodystrophy treatment. Specifically, if you have lipodystrophy, which is soft tissue facial wasting in certain conditions, Sculptra is injected and can actually plump up the area. And it is covered under health insurance. Do your own research, of course, but Sculptra costs in the US are much higher than in Europe, Asia, and other areas of the world. It will be interesting to me because if there's a spotlight suddenly on all the costs of pharmaceuticals, next up may be dermal fillers, class 3 agents. I would think that from a PR perspective and possibly even from another executive order, dermal filler pricing for specifically Sculptra may be lowered. Now, pretty much every other dermal filler in the US has a cosmetic or aesthetic use. It's not covered under Medicare. Health insurance will not pay for it. So I am not certain that prices will actually be lowered for dermal fillers at all. Finally, breast implants. To me, obviously, these are not pharmaceuticals. However, there is a spotlight on all healthcare costs. You may not know this, but breast implants for health insurance or reconstruction, as well as breast implants for aesthetic use, are literally identically the same. Also, manufacturers make the same identical breast implants and sell them throughout the world. They're not different in Europe, Asia, South America, Africa, or the Middle East. So again, I already know this, but breast implant prices for the same exact implants outside the US are much lower than they are in the United States. I anticipate that there will be a spotlight because now you know breast implant prices are artificially a little higher in the US. So it'll be interesting to see with the spotlight on pharmaceutical pricing, if the spotlight on breast implant pricing, which is much higher in the US, will be dropped because people are going to start comparing it to the use of breast implants, the same exact ones, in the rest of the world. There are obviously a lot of breast reconstruction cases in the United States, so we shall see what happens over the next couple of weeks or months. So there you have it. If you have any questions about what I've said or have any other insights that I'm not aware of, please let me know in the comments. And as always, thanks so much for watching. If you enjoyed this video, here's a great video on how tariffs may affect plastic surgery. And as always, if you have other insights or other questions, please fire away in the comments or questions below. Thanks so much for watching.
you.